Bismillahirrahmanirrahim. I am Professor Dr. Saeed Ahmed Gilani and I'm going to discuss a published case which was about ultrasound for diagnosis of infantile axillary cystic hygroma. It is about a male infant of 4 months who was sent to Gilani Ultrasound Center for a diagnosis of a large soft lump in the axillary region. The mass was non-pulsatile, soft, and was looking non-tender because the infant was not showing worsening response to compression. It was first baby, no history of RH incompatibility, and no history of maternal hypertension, diabetes, or any other chronic disease. The baby was examined with Toshiba Zerio with linear transducer 7 to 14 megahertz and convex transducer 3 to 6 megahertz color power and spectral Doppler were applied to know about blood flow in the mass feeding vessels or any communication with the blood vessels. The procedure was performed under the AIUM practice guidelines, which are routinely observed in the center. The procedure were explained to the baby's grandmother who was accompanying the baby and informed consent was signed. The pre-approval was obtained from the Institutional Review Board and Ethical Committee. A large multiloculated cystic mass was observed with septation. It was large enough cystic lesion to be coupled in the field of view of the linear transducer. For the visualization of its global view, convex array transducer with 6 cm front footprint transducer was selected and the mass was measured to take its dimensions. The dimensions were 51.1 into 43.5 into 48.4 millimeters, which is equal to 56.3 millimeters cubic. No blood flow was detected on color Doppler, although acoustic streaming was seen with compression. There was no communication of the cystic lesion with any of the vessels of lungs. It was outside the rib cage, just beneath the skin, in the subcutaneous region. Although sonographic appearances and Doppler criteria were suggested of cystic hygroma, which is also called cystic lymphangioma. Here is that baby, and this was a mass in the armpit area. A close view, the right nipple, the male breast nipple, and this is that mass. Here is the non-pulsatile and non-tender mass at the right axillary region. On ultrasound, it was a cystic lesion with septations inside. It is with the linear transducer. This is for a global view with the convex transducer. We can see the measurements here. These are the septations. And on Doppler, it was having no flow. So color Doppler applied. We tried with the compression also, but there is no flow. This movement is color releasing due to movement of the transducer. So this was the study which was published.